The rollout of updated COVID vaccine boosters has descended into chaos, leaving Americans confused, frustrated, and at risk. What was supposed to be a straightforward public health measure has instead become a bureaucratic nightmare, disproportionately affecting the most vulnerable among us. The initial deployment under the Trump administration has been marred by a perfect storm of access issues, misinformation, and turmoil within U.S. health agencies. People eager to protect themselves from the acute and long-term risks of COVID are facing a labyrinth of obstacles. Imagine wanting to shield yourself from a potentially devastating illness, only to be met with unclear eligibility requirements, appointment booking hurdles, insurance claim battles, and even misinformation from pharmacists. This is the reality for many Americans right now, and this is the part most people miss. These barriers disproportionately impact communities of color and low-income individuals, exacerbating existing health disparities. Experts warn that the very people who need the boosters most are the ones struggling to access them. The situation is further complicated by conflicting messages from officials. Robert F. Kennedy Jr., Secretary of the U.S. Department of Health and Human Services, HHS, declared, "Anybody can get the booster," only to backtrack, stating it's not recommended for healthy people. This kind of mixed messaging only adds to the confusion and erodes public trust. Take Matt Shipman, a health writer in North Carolina, for example. He, like many others, was eager to receive the updated shot, especially with the late summer COVID wave surging. Yet, he encountered a system seemingly designed to deter vaccination. Pharmacies were out of stock, doctors' offices refused to provide prescriptions, and the entire process felt like navigating a maze blindfolded. But here's where it gets controversial. In some states, pharmacists are legally barred from administering vaccines not explicitly recommended by the CDC's Advisory Committee on Immunization Practices, ACIP. This bureaucratic red tape, coupled with liability concerns for pharmacists, creates a chilling effect, leaving many without access to potentially life-saving shots. The ACIP meeting scheduled for mid-September, where updated recommendations were expected, has been mired in controversy. Senator Bill Cassidy called for its indefinite postponement, citing the recent upheaval at health agencies. This delay only prolongs the uncertainty and leaves millions in limbo. "It's incredibly frustrating," Shipman said, echoing the sentiment of countless others. "This is a completely avoidable crisis. People who want the vaccine are being denied access, and it's going to cost lives." The chaos isn't limited to adults. Vaccine availability for children, especially those under 5, is even more scarce. Pediatricians are grappling with new limitations and legal risks, leaving parents like Joanne Hilden, a retired physician, desperately searching for updated vaccines for her grandchildren. Is this chaos intentional? Some, like Ian Morgan, a postdoctoral fellow at the National Institutes of Health, believe so. He points to Kennedy's messaging as a deliberate attempt to sow confusion and discredit scientific expertise. The chaos is the point, Morgan argues, and it's harming the American people. Morgan is one of 1,000 current and former HHS employees who have signed a letter calling for Kennedy's resignation. Structural barriers further exacerbate the problem. Julia Lynch, a professor at the University of Pennsylvania, highlights the stark disparities in vaccine access. In her experience, predominantly white suburbs had readily available appointments, while neighboring communities of color faced significant hurdles. Transportation, internet access, and technological literacy also play a crucial role, creating a digital divide that leaves many behind. For individuals like Rachel in Pittsburgh, who has underlying health conditions, the uncertainty is terrifying. "It's like 2021 all over again," she said, recalling the initial scramble for vaccines. The lack of clear information and the constant roadblocks make it feel like they're trying to discourage people from getting vaccinated. Sarah in Westchester County, New York, faced a similar gauntlet. After days of effort, she finally received the shot, but not before encountering faxed prescription issues, pharmacist skepticism, and a hefty out-of-pocket cost. It's like they're trying to make it as difficult as possible, she said. While some, like Shipman, eventually succeed in their quest for vaccination, many others are left behind. The system, as it stands, is failing those who need it most. Is this the kind of public health response we should accept? Shouldn't access to life-saving vaccines be a fundamental right, not a privilege reserved for those with the time, resources, and persistence to navigate a broken system? The current situation demands urgent action and a reevaluation of our priorities. What do you think? Is the chaos surrounding COVID boosters a result of incompetence, deliberate obstruction, or something else entirely? Let's continue the conversation in the comments.